Nurse midwife may ask if there's a family history of these and other conditions that tend to run in families.
First, I'd like to examine your thyroid.
Knowing a patient's overall health is very important. So is knowing if the mother has had and is immune to certain illnesses such as German measles, which can be dangerous to the fetus. A blood test can provide some key information.
At the first visit, we check for the presence of protection against German measles. We check their blood count. We check their blood type to make certain that she doesn't have a problem reacting with the baby's blood. We check for other infections such as syphilis, HIV, hepatitis. We also check her urine, and we screen her for cervical cancer with a pap smear.
There are other DNA tests that can be done, but without...
Another person you might see is a genetic counselor. Several kinds of birth defects can be passed from generation to generation. A genetic counselor can help determine if you're at high risk for passing along a genetic disease, such as cystic fibrosis, hemophilia, muscular dystrophy, mental retardation, among others.
Helping patients decipher that information is another part of genetic counseling and helping them make decisions about what to do with the information. Why don't we start with your side of the family?
Genetic counseling may prompt some couples to seek diagnostic testing of the baby's chromosomes. Others opt for these tests because the mother, like Marcy Spear, is 35 or older. Statistics show that as women age, they're at somewhat greater risk for having children with birth defects, like Down syndrome.
I mean, I've always planned that everything's fine, and that's what I'm expecting, and all the numbers are in our favor, but this test just provides us with a little bit of extra reassurance.
They can be reassuring, but diagnostic tests cannot check for all possible birth defects, and they do carry some risk. Another factor to consider is whether your medical coverage handles the cost.
You may have heard of one early test called CVS for chorionic villus sampling. Cells from a part of the placenta called a villus are extracted and analyzed in a laboratory. The procedure can be done early in pregnancy, between the 9th and 12th weeks.
Chris, you can feel just a little prick now.
A more common procedure is amniocentesis, which is done a few weeks later.
And this will just take a couple of minutes just to draw off the fluid.
Perhaps you've heard it called an amnio. The name comes from the amniotic fluid surrounding the baby.
And in our institution here, we usually do them around 15 to 16 weeks. It's a procedure that involves insertion of a needle into the uterus. It draws off some of the fluid from around the baby, and in the fluid are some of the baby's cells, the fetal cells, and those cells are sent to the laboratory for analysis.
It really wasn't painful. When I got my blood drawn, that hurt. When I had the amnio, it was a cramp, and then it was done.
In addition to minor side effects like cramping, amnio and CVS carry a slight risk of miscarriage. That risk is less for amnio, which also provides more information than CVS.
Amniocentesis will also provide a measure of a substance called alpha-fetoprotein, or AFP. It's a way to check for the possibility of openings in the developing spine called neural tube defects. The AFP reading is also available from a blood test. A blood test can also check for the possibility of other abnormalities, such as Down syndrome. But a blood test is only a screen. If it indicates a problem, you might have an amnio after all as a follow-up.
And the baby's heart.
Another way to follow up is with ultrasound.
So profile of the baby's face.
Many healthcare providers use ultrasound throughout the pregnancy to assess the growth and health of the fetus if necessary. To date, there have been no problems found with repeated use of this procedure, which uses sound waves to develop an image.
So we can actually get a good view of the developing fetus and of the uterus. And this is traditionally done at about 18 weeks to look for structural birth defects. It can also be done much earlier on to confirm that the pregnancy is alive, that it's in the right place inside the uterus, and that the pregnancy is not a tubal or an ectopic pregnancy.
Something else that ultrasound might reveal is the sex of the child.
I think that's going to be a girl.
Oh my goodness.
It's just a visual impression, however, and not always accurate. CVS and amnio, on the other hand, will give you definite information about gender from the chromosomes. So there's another decision for you to make up front. Are you going to have them tell you or let it be a surprise? You'll also need to talk about when you're going to share the news. Many women wait until they're visibly pregnant. That's at about 20 weeks the first time around, earlier if you've been pregnant before.
And some couples wait until they're more secure about their expectations. The risk of miscarriage is much higher in the first trimester. But certain people should be told you're pregnant right away. Your employer, if there are potential workplace hazards such as radiation or chemicals, and any healthcare provider you encounter, including your dentist or pharmacist.
Next, we'll talk about strategies to help protect your health and your baby's.
Report 3. Management.
It's good to keep in mind that both of you are expecting a baby. That means going to appointments together when possible. And later it could mean attending birthing classes in the labor and delivery method you choose. And fathers can join in the effort to focus on good nutrition.
That makes it a lot easier for the mother to make sure she's providing the baby with enough protein, carbohydrates, fats, vitamins, and minerals.
A balanced diet includes each of the following food groups every day: milk, yogurt, and cheese, including the low or non-fat kind, vegetables, meat, poultry, fish, dry beans, eggs or nuts, fruits, and bread, pasta, cereal, and rice. As always, you need to be careful about fats, oils, and sweets.
If patients are concerned about their weight control, pure sugars do not usually carry any other nutrition, and they're simply empty calories. So that I would recommend that patients avoid sodas and candies when they're pregnant, because most people are concerned about how much